Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're diving into something many people experience, but often overlook and just live with it. It's called tennis elbow. Yes, and by the way, it's not just for athletes. Whether you're lifting groceries, working at a desk, elbow pain can sneak into your daily life. So, to help us better understand this common but painful condition, I'm honored to welcome a brilliant physician and specialist in regenerative medicine, Dr. Bryn Henderson. Dr. Henderson is a respected physician known for combining traditional medicine with cutting-edge regenerative therapies. His work in musculoskeletal care and non-invasive treatments has helped countless patients regain their mobility and quality of life. So today, he joins us to talk about the science, the symptoms, and the solutions behind tennis elbow. Thank you for being with us today. So let's get right into it. What exactly is tennis elbow?
Well, thank you, Dr. Pizzanti. Tennis elbow, or lateral epicondylitis, is a condition where the outer part of the elbow becomes painful and tender. It happens when the tendons that connect our forearm muscles to our elbow get overused. Despite the name, you don't have to play tennis to get it. Anyone who repeats wrist or arm movements, like typing and painting or lifting, can develop.
Who else gets tennis elbow?
It's most common in adults between the ages of 30 and 60, but can affect anyone. Both men and women get it, and it's often seen in people with active jobs or hobbies, mechanics, plumbers, housewives. Over time, repetitive motions wear down the tendons and cause the pain and weakness.
All right, so let's talk about typical symptoms that somebody might notice.
First sign is usually pain on the outside of the elbow, and it can spread down your forearm, and many people feel weak when gripping things, like opening a jar or holding a cup of coffee. Some feel stiffness or tenderness when moving their arm or wrist. The pain may start mild, but it gets worse if not treated.
So how would a provider, a physician, our nurse practitioners, physician's assistants, anybody who's in this field of medicine and treating, what do they do first?
Good question. In most cases, it's a simple physical exam, and it's usually enough. We ask the patient to move their wrist and elbow in certain ways to see where the pain shows up. Tests like the Mills test are very helpful. We only order imaging like ultrasound or MRI if the pain isn't improving or we suspect something else.
So what's this Mills test?
Mills test is when you're determining the range of motion for the epicondyle. Mills test is a maneuver. You move the wrist and hold this right, and move it, and it hurts.
So the provider touches the elbow, makes the patient move their wrist, and what are they looking for?
Pain, and it hurts when you pronate. Supination's when the palm is up.
Yeah.
Pronation's when the palm is down. And when you're moving it and it hurts there, you can pinpoint right where the tendon inserts to the outside of that bone.
Interesting. All right. So now that we know the Mills test, let's talk about treatment. What's the first step when someone has tennis elbow?
The first step is always to give the elbow a rest. We ask patients to rest the arm and avoid doing activities that cause pain. From there, we start therapy with a physical therapist or a kinesiologist to gently stretch and strengthen the forearm muscles. Many people find relief using elbow braces or straps. It takes the pressure off the sore tendon. Over-the-counter medications like ibuprofen can also help reduce the pain and inflammation. And here's something simple but effective: topical pain relievers. Often we recommend using aspartame with lidocaine during the day up to 5 times. It numbs it and it helps reduce the inflammation, reduces discomfort, and you can go about your daily routine. At night, we switch to BioFreeze Overnight Gel, which has a cooling effect that helps ease pain while you're asleep for up to 6 to 8 hours.
Are these covered by insurances?
No, they're over the counter.
Both of them?
Yes, and they're very inexpensive.
Oh.
These are great tools to manage the inflammation, and that's what precedes the pain.
So what if the pain doesn't go away?
If it's not improving after a few months, we look into advanced options like injections for quick relief or regenerative therapies like platelet-rich plasma or even exosomes or stem cells. These aim to heal the tendon instead of just masking the pain.
All right, you mentioned peptides and regenerative therapies. You've been doing this for 15 years, let alone practicing for 45. So what are your favorite peptides that you've used that you've had success with?
The peptides we use in this instance would be BPC-157 and or thymosin beta-4. Both help reduce inflammation, speed up the healing at the cellular level, and increase some circulation. Stem cells, on the other hand, rebuild the damaged tendon. Both are very promising options for chronic cases where other treatments have not worked.
Let's talk about a case you recently had about that older woman with long-term elbow pain.
Yeah, that was quite the case. She was a 69-year-old housewife who came in with right elbow pain that's been bothering her for months to years. She had a history of tendon surgeries and other injuries from everyday activities like lifting and gardening. We started with conservative care, gradually introduced peptides, hyaluronic acid. Over time, her symptoms improved, her grip strength returned, and she feels 10 times better.
Well, that's great. I do want to ask you about hands. A lot of times I have people who come in and they go, Doctor, I've lost my grip. My hands are swollen. It's really not neurological. Could it be that they actually have this tendinitis of their elbow and they're not feeling the pain in the elbow, but their hands are showing them like their body is going, hey, you've lost your grip?
Absolutely, because the muscles in the hand originate in the forearm. So conditions like arthritis, hypothyroid, and even anxiety can slow down recovery. These affect how well the body heals the tendons. That's why we take a whole person approach, sometimes involving hormonal balance, stress management, and nutrition alongside all the physical treatments.
All right, let's talk about alternative therapies that you recommend, that you have had success with, and that maybe our audience have never known that you could fix a pain in your elbow with Chinese medicine.
You bet. Acupuncture and traditional Chinese medicine can help you too. They work by improving energy flow. Blood circulation around that elbow is essential because everything heals in proportion to its circulation. So points like LI11 and TE5 are commonly used. Combined with Western therapies, they can provide great results, especially for chronic or stubborn cases.
What would you like our listeners to remember most when it comes to tennis elbow?
Oh, early care makes all the difference. The sooner you get in and the sooner you give it rest, the faster it heals. And you don't have to wait until the pain gets severe. Please don't wait until the pain is severe. I recommend a strategy called elbow rest. It helps patients remember the core steps of managing tennis elbow every day.
So elbow rest, what does the E stand for?
Ease the strain, stop or reduce the repetitive movements.
L.
Load gradually, begin gentle strengthening and stretching as the pain improves.
B.
B is for brace or support. Use a forearm strap or an elbow brace to reduce the strain on the tendons.
O.
O is optimizing the ergonomics. Adjust work tools, posture, or grip to avoid overuse.
W.
W is for work with a therapist. Physical therapists, kinesiologists, both can improve strength, flexibility, and function.
R.
R is rest that joint. Take breaks from aggravating movements to allow the healing.
E.
is easing inflammation. Inflammation precedes pain. So use ice packs and anti-inflammatory medications as directed.
S.
S is stretch. Stretch and strength. Forearm stretches and exercises help recover.
And T.
Talk to your doctor. Your physician will help you with your persistent pain. Explore options like the injections, PRP, or other treatments. This isn't just about healing tendons. It's about restoring confidence, function, and the comfort in your lifestyle.
Wow, that is a wealth of insight, and I thank you, Dr. Henderson, for shedding light on this very common but often misunderstood condition. To our listeners, if you're living with elbow pain, don't shrug it off. It could be tennis elbow, and there's help available, from therapy and braces to regenerative treatments that rebuild what's been worn down. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.